supported by the U.S. President's Emergency Plan for AIDS Relief, PEPFAR.
The American International Health Alliance. We do development differently. The United Republic of Tanzania is best known for Africa's highest mountain, Kilimanjaro, and wildlife-rich national parks. Home to stately elephants, prides of lions, huge migrating herds of wildebeest, and many other wild animals native only to Africa. These creatures are a wonder to behold, for sure. But for the American International Health Alliance, or AIHA, it's humanity they seek to serve, building partnerships to help Tanzania strengthen compassionate care for its most vulnerable citizens. Not far from Mount Kilimanjaro in the northeast rests the sprawling city of Arusha, a place of many contradictions. While it is the center of safari tourism, a significant source of national income, it also struggles to provide adequate resources for the poor, sick, and elderly.
Arusha needs more social welfare officers to help link people in the poorest neighborhoods to adequate nutrition, medical, and mental health services. We emphasize two main issues: vulnerable children and HIV/AIDS patients.
To help bridge the gap, AIHA, working closely with the Tanzania Ministry of Health and Institute of Social Work, initiated the Twinning Center program. Partnering with the Jane Addams College of Social Work and Midwest AIDS Training and Education Center at the University of Illinois. Together, they developed the Tanzania Parasocial Work Program, designed to empower existing community-based volunteers by improving their ability to identify, evaluate, engage, and link those in need to existing care and support services. Habiba Balamula successfully completed the Parasocial Worker course and now serves at-risk children and vulnerable households.
I know the children in this ward and what they need. I speak to the family and make sure the children receive help like other children, since all children are equal no matter what situation they are in at the time. They don't stay children forever. They will grow up to be men and women. If I'm able to help these children, then we've already helped the youth and adults of tomorrow.
Has the child been sick again?
My child is not as sick because we've been doing the things you told us about.
HIV/AIDS is most severe in sub-Saharan Africa. The pandemic poses a continuing threat to public health in Tanzania. It's especially prevalent in families with limited means and education, often striking innocent children at birth. Elia Edward is a primary school teacher and volunteer parasocial worker focusing on children with HIV/AIDS.
Before the training, there were many people living here with HIV/AIDS, but there was no one to help them. By visiting the children often, advising them and encouraging them, they began to improve. We let them know they are not alone, and there is hope for the future.
Families are suffering in isolation, not just from the horrors of HIV/AIDS, but also from the social stigma associated with being infected. Angel Martin knows the importance of seeking out the hidden children with HIV/AIDS.
We have to be the ones to go inside and take the sick child to the appropriate service. It's hard for the parents because they fear their child will face discrimination.
This parasocial worker program and AIHA's multi-pillar approach to creating sustainable, needs-driven change has strengthened the social work profession nationally in Tanzania, giving hope to many families who once faced an unsure path forward.
AIHA, in partnership with other stakeholders, have helped to ensure parasocial workers get the training they need to do this important work.
And the key to the success of the Parasocial Worker Program rests firmly in the hands of the dedicated community-based volunteers.
I don't want very big changes, but only one step or two steps, it become to have very big changes. So one more step, two more steps, it makes me feel happy.
I had a difficult childhood, and I asked God to help me so that when I succeed, I would help others. Now that I have a job, I'm able to give back.
I really love helping children and people so they may live a better life like we live and have faith in themselves the same way we have faith in ourselves.
For more information on this program and many other humanitarian efforts spearheaded by the American International Health Alliance, visit AIHA.com.
activities carried out under this PEPFAR-supported project are funded by the U.S. Centers for Disease Control and Prevention and are managed by the American International Health Alliance's HIV/AIDS Twinning Center program. The Twinning Center is funded through a cooperative agreement with the Health Resources and Services Administration of the U.S. Department of Health and Human Services under grant number U97HA04128. The content of the preceding video should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government.